To what extent is gender a kind of performance? In the case of Caster Semenya, a cultural demand for gender makeover was present, and she played her part well, just as crossdressers and transsexuals play the parts prescribed to them by society, as how to act a certain gender using stereotypes and idealized images. But is this kind of gender performance applying to everyone? Take a look at this picture. The picture of feminine glamour and beauty. However, this picture is of an elementary school-aged girl. These girls and their parents work hard to achieve feminine beauty through makeup, diets, tanning, glitzy clothes, hair extensions, false teeth. Most of these are the tools adult women use to be seen as feminine. If these beauty pageant girls are seen as wrong or unnatural, why should women be perceived any differently? What is it that they're really objecting to? If to be a mature-looking, beautiful woman takes nothing but a knowledge of how to apply makeup and a way of carrying yourself, then it seems what we know as gender is nothing but a performance.
Another example of gender identity as a performance is the mannerisms that are put on by stereotypical queer people in the media, especially gay men. Men who act in an effeminate or swish way are perceived to be flamingly gay. Where do these mannerisms come from? It could have come around as a way for homosexual men to be able to identify each other in a very heteronormative society. In the 60s, many people in the gay community were anti-swish behavior because of their visibility and misrepresentation of the gay community. In an article by Craig Lofton from the USC, said, quote, "Most homophile writers seem to have regarded swishiness as social construction rather than an inherent disposition. They believed that all gender behavior was performance to some degree, but feminine behavior was more of a performance for men because it went against conventional gender socialization." This stereotypical characteristic of gay men seems to have never gone away, and has in fact been emphasized heavily in the media recently, reframing feminine men as trendy and desirable.
How does style of dress contribute to our perception of sexuality? When most see a man dressed well and groomed to perfection, or a woman in baggy clothes, it is not uncommon to jump to conclusions about their sexuality. In Western society, the gender traits displayed by an individual are commonly seen as indicators to sexuality. And when these traits are reversed, we often assume that the individual is queer. Some of this idea is based in attraction. People dress in ways that are culturally appealing to the person they want to attract, or at least what culture shows as appealing. So a lesbian woman may choose to wear masculine clothing to appeal to a more feminine lesbian woman, and a gay man may dress more stylishly to attract a more masculine gay man, and vice versa. And what about people who dress to attract the opposite sex? They rely partially on what is considered attractive in society. Tight skirts, high heels, clean-cut shirts, and nice jeans are some examples. It just depends on the audience they desire. There are ample sources from which heterosexual people can learn the right way to dress in order to attract potential mates because of the distinct heteronormative bias that exists in our culture. It's much less common to find advice on how to dress to attract that special lady in a fashion magazine than that special man.
The ability to dress attractively can be employed to suit others' needs as well. But does a gender appearance affect one's opportunity and social status? In the business world, looking nice is a must. It carries implications that the wearer is neat, responsible, and affluent. But what is nice when it comes to gender? There has historically been a wage gap between men and women. However, when looking at the demographics of women alone, there are other distinct wage gaps. Women are held to a higher standard in the workplace of looking nice to getting promoted/taken seriously. Take Hillary Clinton or Sarah Palin, for example. While both are on very opposite sides of the political spectrum, the hair and outfits of both women were brought to attention far, far more than was the hair and outfits of their male political peers. For men, dressing nicely is easier. suit, 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 golf suit. They are historically favored over women for promotion. A few statistics. Attractive people earn 5% more. Overweight women earn 17% less. Taller people earn 2.6% more. Attractive people earned 9% less.
Is the external appearance of one's body affected by pressure to conform to the appearance of a certain gender? Of course. There's liposuction, breast enhancement for women, breast reduction for men. But sometimes the pressure to fit in begins from birth. When a baby is born, the exhausted and expectant mother and father ask, "Is it a boy or a girl?" Doctors make a quick and painless evaluation based on the child's external genitalia. But sometimes the answer isn't simple. 1 in 100 children are born intersex, possessing both female and male traits, often resulting in ambiguous genitalia. These in-between genitals are described by doctors as obtrusive, embarrassing, offending, disfiguring, and troublesome.
When this occurs, doctors suggest cosmetic surgery. Right away, once they test the chromosome identity of the child, XX or XY, if they're XX, the phallus is shortened. If XY, they evaluate whether the phallus is long enough to improve the hormones and time. If not, they are defaulted to female and are given genitalia as such. About 90% of intersex children are assigned to be female, which means that approximately less than half of them have an XY chromosomes. The doctors feel that it is in the children's best interest to appear normal, so that they will be able to be accepted in society and be able to be married, etc. These benefits of normal genitalia rate higher than having fully functioning genitalia. Example, pleasurable sex reproduction.
Oh, hey. Hi, I haven't seen you around here before. My name's Molly. What's yours?
Oh, hang on. Oh, we can't be friends.
Not again. Stupid genitalia.
In this gender equals garment culture we live in, when one decides to transgress the norms, one must also conform to the stereotypes. While everyone's experience and reasons for transitioning are different, the common reality of being transgender is identifying as the opposite gender. When a person decides to transition, the first step is to dress, act, and look like their chosen identity. Considered for sex reassignment surgery or SRS, an individual must first spend 1 year presenting as their chosen identity. During this time, they must also get therapy from 2 trained therapists who specialize in transsexual therapy, as well as begin hormone replacement therapy or HRT. HRT will help them become more like their desired gender by artificially shifting their balance of hormones. After meeting these requirements, they must go through a number of mental and physical assessments before they can get SRS. Male to female transsexuals, MTF, undergo a vaginoplasty. Female to male transsexuals usually get breast reduction surgery and phalloplasty. Both of these surgeries are highly expensive and become more expensive when factors like hospital stays and other aesthetic and cosmetic surgeries are included. All of these surgeries are done to make the individual appear as their chosen identity. Pretty extreme for an outward appearance, but transsexualism reaches far deeper than skin and clothes. It is currently defined as a mental disorder by the American Psychologists Association, APA. The disorder is labeled as gender identity disorder and is defined by a persistent cross-gender identification, discomfort with physical sex, and the disturbance causes clinically significant distress or impairment in social, occupational, and other important areas of functioning. These surgeries are the main way of treating GID. Physical changes are far more affirming than just cross-dressing for transsexuals.
But are these identities based on cultural stereotypes? Yes and no. The physical, surgical, and hormonal changes are implemented to change biological gender. Mannerisms and clothing, however, are definitely based in stereotypes. Most people want individuals to fit into a single gender identity, but not all trans people do. There are, of course, people who transition and fit into typical roles, but there are also male to female tomboys and effeminate female to males. Trans people almost have to overplay the stereotypes to fit in, much like drag royalty. For most transgendered people, though, the stereotypes aren't really who they want to be.